after just one appointment, we were able to go from what we see on the left to the right. And that was actually done by using the injection molding composite, the 12-step technique of how to do this. So first, we're going to make we have our two different wax up. We're going to make a clear impression of the every other tooth model, all right? And so you're just going to make the impression and you have it, you set it aside. The second thing we're going to do, we're going to make a clear impression of the full wax up model. So now we have full wax up model, clear PVS impression, and we have the every other tooth. From that, we're going to then utilize one of our metal hubs to actually punch a hole through the incisal portion of the teeth that you're actually going to be injection molding. So what I would do is first take the full wax up model, or not the full wax up model, but the every other tooth model, and the teeth that are fully waxed up on the every other tooth model, say it's 6, 8, and 10, you're going to poke a hole straight through that, okay, to the outside. And you're going to push it through there. Now, if you can see as you poked it through, you see the little piece of PVS that is coming out. You want to make sure you take that and clean that away, the little punch after each pass through. And then we're going to move to the mouth, okay? So then I'm going to do a minimal preparation of the teeth. Many times I'm going to micro etch with 50 micron silica, aluminum silica, and just that helps the bonding strength. I'm also going to take sandpaper discs and smooth the edges of any sharp points because those can introduce like fracture points. Once you've gotten everything ready to go, you can see here the teeth are more hazed over, and that's due to the sandblasting. You're then going to take Teflon tape and you're going to actually put it around the teeth that you're not working on. You're then going to etch, prime, and bond and cure before you put everything on there. So here we are etching every other tooth, and then we're going to prime and bond just however you do that, and then you're going to cure each one of the teeth. From there, you're going to seat the matrix, and you're going to insert the metal tip all the way to the base, and you want to keep it buried as far as you can kind of get it in there. I would say up to the gingival third. And what you'll do is you'll start to inject the composite. You will actually see it flowing out and kind of moving around. And as it starts to fill up in that area, you're going to slowly withdraw it until you get all the way to the apex. One thing that's really important is to not take the hub out until it's all the way full. If you accidentally tape it out too much and you put it back in there, you're probably going to introduce a bubble in the area. So that makes it really, really difficult. When you're doing injection molding in the posterior, it works really, really well for the anterior. In the posterior, it does work pretty well. You just need to have adequate thickness, and sometimes you're lacking that in the posterior. Also, you're going to want to have at least 2 holes in the injection molding PVS, and one is so you can actually inject into, and the other hole is so the air can flow out and the flowable composite can move through it a little bit better. And that's just something you need to do in the posterior. Then moving on to step 11, then you're going to do final smoothing and occlusal adjustments. So, you can take a look at things. You want to have good anterior guidance and excursive movements. And you want to have the teeth hitting where they should be hitting and not hitting throughout that area. And then you're going to go through your final polishing and finishing, utilizing whatever materials that you want to use with that.